Hi, I'm Nicole. Here is my sheet with my name, today's date, and then just the list of bones to keep me organized when listing them. I as well have my skeleton. We will list all of the bones after I answer a few questions on the skeletal system. So the first being categorize the main components of the skeletal system. So a few of the main components is support, providing structural support for the entire body, mineral storage. It stores calcium, which is the most abundant mineral in the body. It allows for blood cell production. It forms red blood cells, white blood cells, and platelets. It is protection for the entire body. So things such as the skull protects the brain, the ribs protect the heart and lungs, and lastly, leverage. So it allows for precise, direct movement, range of motion. It allows for the proper gliding of movements. The second question is classifications of the bones according to their shapes. So we group 206 major bones into anatomical categories based on their shape and identify them through their landmarks, so based on their bone markings. There are 7 categorized bone names through shapes. The first being the sutural bone. It's small, flat, and oddly shaped bone, usually found between the flat bones of the skull as an example. The second being the pneumatized bone, which is hollow or contains air-like pockets, such as the ethmoid bone in the skull as well. The third is the short bone. It's box-like, and usually an example is the carpal bones within the wrist. The fourth is irregular bone. It is complex in shape with short, flat, notched, or rigid surfaces like the sternum. 5 is flat bone. It's thin, roughly parallel surfaces of complex bone like the sternum and the ribs. 6 is long bone, which is pretty self-explanatory. It is long and slender, such as an example is the humerus. And then lastly, the 7th is the sesamoid bone, which is usually small, round, and flat, like the patella of the knee. The third question is mentioning and showing the cranial bones, as well as the axilla and appendicular skeleton, and to name all the bones and show their exact locations. So, we are going to start with my sheet, the axillal division, the cranium. There is frontal, parietal, which is the 2 on the side, you can kind of see, and then temporal, which also has 2 on the sides, and then occipital on the back. Inside, in the front is the ethmoid, and then the sphenoid is kind of the side below it. In the face, there is the maxilla over here, the palatine, which you can see inside the mouth. It's kind of like this back area over here. Nasal, so the top bone over here is the nasal. I'm hitting it with my pointer finger. Inferior nasal cochlea, which is inside and inferior, so below, inside the nose and on the side. Zygomatic, which is over here. Lacrimal, which is inside the eye, and medial, so like inside kind of in the corner where like the tear ducts are. The vomer, which is that in between kind of bone in the nose, as well as the mandible. Then there's the vertebra. There's cervical, thoracic, lumbar, sacral, which is over here, and then coccygeal, And then there is the sternum in the middle, all over here, ribs. There's the true ribs, the false ribs, and then the floating ribs as well. That is the axial skeletal division, and then the appendicular division, which includes the clavicles. So the clavicles right here, the scapula in the back, humerus, my pointer finger, the radius. This is a little bit challenging. This bone here is the radius. Then the ulna, which I'm sliding up and down with. From there is carpal bones. So this on my pointer finger is the carpal bones. Then the metacarpals. And then the phalanges. So it goes carpal, metacarpal, phalanges. Then from there we travel down the hip. If I can move the skeleton's arms, upper extremities. The hip bone. We have the ilium, the ischium back here, and the pubis in the front. Then from there we have the femur that I'm sliding up and down, the patella, the tibia, which I'm also sliding up and down, the fibula. Then on the feet, place this down, the tarsals. On the front of the foot, we have the metatarsals. It's like all over here, and then the phalanges. That is all the bones in the skeletal system, from the top cranium to the bottom of the feet. The last question is provide an example of clinical application of anatomy within my future career. Honestly, even in my current career, I'm using the whole skeletal system. I'm an occupational therapist, assistant. I want to go on to OT, and then I specifically want to go into hand therapy. So I use the names of the bones every single day. I use the context of the skeletal system through a range of motion, like the leverage of the skeletal system. I use directions when thinking of exercises for patients. I use the word range of motion every single day, and it's really important to know the landmarks, the names, the locations of the bones all inside the body for OT, especially since I am specifically in orthopedics, which is ortho, all the bones. So I will use this every day for the rest of my career, the bones, and I even to this day use them all the time. So the skeletal system is very important in OT and in my daily life. Thank you.